I decided to set up practice in Cheticamp, primarily because when I was a medical student, I did a rotation here and I really enjoyed it. My name is Michel Chiasson. I'm a rural family doctor. I loved how the doctors were working together, how they got to know their patients very well, how they worked with everyone else on the team. And I could really see myself working in that environment and raising a family here. There are several things that make my practice effective. I would have to say the first thing is the people. You really need to have a good team, and we have a wonderful team here in Cheticamp. The nurses, the occupational therapists, the secretaries, the dietitians, and the list goes on, but we work very closely together. Pas content avec son contrôle, elle est supposée de vous voir la semaine qui vient.
Changer ses médicaments ou bien...
We can cover each other, we can help each other. There's always somebody that you can kind of talk to and discuss a case with or get help with a patient. You know, all of us go and we do different medical education, and we bring that information back and we share it with each other. You know, one of the things we do to ensure communication is we have a formal team meeting, and we do that once a week. We talk about our inpatients. We also talk about people in the community that we have concerns about. As well, here at the clinic, we're using our electronic medical record more and more to be able to send messages. So even when I'm not in the community, I'm still checking on my patients, their results. I'm communicating with our family practice nurse or my colleagues to ensure that my patient care is evolving. Collaborative practice means the best possible care for my patients. So not just staying in my clinic, but getting out to the youth health center, going to the nursing home, doing home visits, visiting the local Buddhist monastery. It's really important to be involved in the community. As well, one of the things that I enjoy is being involved in coaching, trying to be a role model or mentoring youth in being active and leading healthy lifestyles. Not just to be a medical doctor, but to try to show the community what it's like to have healthy living. One of the things that we do in our community to provide more care for our patients is recognizing at times they need to see specialists. And we certainly try to promote specialists coming to our community, and that's very important for their care. And at the end of the day, for our patients, you know, we work together to make sure that we're coming up with the right diagnosis, deciding on the right treatments. I get to know my strengths, and more importantly, I get to know my weaknesses. I figure out who else on the team can help me, help my patients, make sure that their care is optimized.